Arlen Specter posted on his Twitter account, quote, people who like their current insurance ought to be able to keep it. But let's have one more choice, a public option. Well, welcome to the dance, Senator Specter. His challenger, Congressman Joe Sestak, who I support vehemently, said on the Ed Show weeks ago that, hey, he's for a public option. Now he's being quoted on Tuesday. He said he would, quote, find it hard to support a health care bill without a public option. We've known that all along. The congressman joins us here on the Ed Schultz Show. Congressman Sestak, good to have you with us.
Great to be back, Ed. Thank you.
You are pushing the envelope with your opponent here. It seems that he has shifted his position, or do I have that wrong?
Well, no, he has definitely shifted. Look, after he shifted his party, since I announced my intent to get in the race, he used to vote about 44% on contentious issues for the Democratic Party. Now the polls show he's doing it at our surveys 97%. In fact, he shifted his position on EFCA since I announced my intention. And finally, he has shifted his position on public option. And you know what? This election really is about leadership. It's nice to see him following mine. But I'm calling on the Senate particularly now, the Senate Majority Leader, Senator Reid, to really demonstrate leadership for principle over politics. Political calculation, place it aside. We need this public option for reform, to control costs. It's needed for the economy. It's needed for our pocketbooks to get the premiums down.
What do you want Senator Reid to do?
I want him to become the majority leader. In a sense, up till now, I think he's watched and he's seen how things are being done by the chairman of the various committees. But a majority leader is elected to lead. And I think he, with the president, needs to be right there every day saying, look, America, this is the set of facts. Senators, these are the facts and why we need a public health care plan option. Coverage of everyone is needed for America. But reform by public care plan option is needed for our economy. Why? First, he needs to make it very clear that we can keep costs down because a public plan option won't have administrative overhead like a private does, nor advertising, nor making a profit. Second, they are going to introduce competition to these health insurance industries where 94% of all health insurance markets, according to the Department of Justice that looks for monopolies, they say 94% of them are heavily concentrated markets across America, meaning it's being close to almost a monopoly throughout America. And third, a national public plan has the bargaining clout to make providers moderate their costs. This is about our pocketbook, and now's the time for him to say, this is what I want, a public health care plan option.
And you think Harry Reid has been sidelined? Do you think he's been too quiet? Not in the mix? What do you think?
I think for too long, pieces of legislation have not gotten through the Senate. And I think that in this particular issue, which is of such great moment for our nation, to where 14,000 Americans lose their health insurance, private one, every day. That's like in the state of Pennsylvania, Bethlehem one week, Allentown another week, Reading the next week, everybody losing their health insurance week after week. That if he doesn't stand and say public health care plan option is absolutely a requirement, and he's moving people to make it happen, I believe that we will end up with maybe saying we're going to cover everyone, but with the cost getting so exorbitant, no one will be able to afford it. That's why we need it, and we need his leadership now.
Congressman Joe Sestak, Pennsylvania, with us here on the Ed Schultz Show. Or do you think the Democrats have to be prepared to do it alone on health care?
Yes, it's unfortunate. Look, Ed, I'd be right up front. I think we could have always brought in reconciliation. I believe that, that we should never sacrifice good policy at the altar of bipartisanship. But I'd like to see the congregation at least try to begin praying together at the very beginning before there's a schism. But on this issue, Americans have suffered too long. With 10 million Americans losing their health care, health premiums up 120% since Arlen Specter and Bob Dole took that poster board back in the 1994 era that was titled Bill Clinton's Big Government Health Care Plan and misled Americans from the reality that his plan would have reduced health premiums, and also Inspector hangs that in his conference room. At least he did so recently till I got in the race. And my take is Americans have waited too long. And is it tough out there to explain it? Sure it is, because they've lost faith in the government over the past 8 years. We need accountable leadership, holding those accountable who failed us, but leadership that says, look, it's not about my job as a politician. It's about your health care and being able to stay in your job, and that's what we need, principle over politics at this moment.
54%.
We could do it ourselves if we have to.
Yeah. Are you ready for the president to draw a line in the sand, or does he still have to keep everything open?
No, I think now's the moment, and I have such respect for this president. But now's the moment for him to stand beside Senator Reid. We know we can do it in the House of Representatives, and to say, this is what's right for America. Look, we have two choices here. We can do it all that will to actually cover all Americans and reform health care to bend down the cost curve.
So let me get this straight, Congressman. Congressman, let me be very clear here with you, because I want our audience to really grasp this. Congressman Joe Sestak of Pennsylvania is now saying that President Obama and Senate Majority Leader Harry Reid should stand together and draw a line in the sand and tell the Republicans we're ready to do this without you.
Yeah, we need to, on the public health care plan option, that is true. I think that we have to explain that a public health care plan option is really a choice. And it's paid for not by the government, by your premiums and copays. It's an equal competitor to stop what's become cartels in certain regions. So I believe right now, and I cannot tell you, if we were not fortunate to have this president right now, we wouldn't even be having this discussion. But now as we go into this period of time of the fall, it's do or die. And this is of such great moment. I most request the Senator Reid, stand up and bring the rest of the senators along. And now I think that wonderful power of his bully puppet, as Lyndon Johnson and others did in the Senate, by this president will make it happen because of the due respect we have for him. And I believe that we'll win.
Congressman Joe Sestak saying now is the moment for the president and the Senate Majority Leader to draw a line in the sand over public option. Well, that's what I want to hear. I agree with you 100%. And if the president does do it, if the president does not do this, if Harry Reid does not engage, do you think that Democratic support will start to peel off?
Unfortunately, I think it will. We've seen that recently. I do want all Americans covered. Look, when my daughter had her brain tumor at 4 years old, in the bed next to her as she began her chemotherapy was a 2.5-year-old boy who had been diagnosed that morning as my daughter began her chemo with acute leukemia. Social workers came and went for 6 hours to see if that boy could stay because their parents did not have health insurance. I was worried about my daughter who vomited 18 times that day, but I listened, and my wife and I looked at us. I was so fortunate with TRICARE. That's why I got into Congress, for everyone to have coverage. But I also got a doctor in political economy. And I have to tell you, if we don't have a public health care plan option, we won't be able to afford the coverage. And that's why we need this fair competition. Otherwise, we're just giving 40 million Americans to the private health insurance companies, and they're going to be able to then just have a bigger market. Where do we get the competition? And so that's why public health care plan option, which is really a private one because it's subsidized by our copays and premiums of those who choose it, but it doesn't pay $23 million to a CEO for a salary or $70 million for a severance pay or the advertising cost. It begins to get us what Americans do very well, competition, but with a fair referee on the football field to make sure it's done where it's fair, like we didn't have for the derivatives up in Wall Street.
You think Pennsylvanians stand with you on the drawing a line in the sand on public option?
When I speak before these town halls, I've done 3 large ones, I've done 2 small ones, and I'm about to do another 2 large. Yes, when you quietly and deliberately explain, and I've been on Fox twice today, just commenting about and bringing out the fact people kind of all of a sudden sit back and say, that's really what it says? And I said, that's what it says. We Democrats have to remember, we can't be in an echo chamber talking among ourselves. It's out there and quietly, deliberately explaining to Americans who have anxiety after post-Iraq, post-Katrina, after bending the eavesdropping laws, at best bending them, if not breaking them. And all of a sudden, they've lost trust in their government. When I joined the military in 1970, we were ranked 15 out of 15 in terms of public trust in the military during the Vietnam War when it joined up. When I left, we were number one. I went to Congress, which was dead last out of the 15 institutions of Gallup poll measures. If there's anything we need to do is to bring back respect to those institutions so once again Americans trust us. And that's why Democrats and everyone needs to be out there explaining why this bill is good for your pocketbook and it's good for a healthy American and it's good for America to bring us into the next century with the right accountable leadership.
Congressman Sestak, always a pleasure. Keep getting after it. I'm a fan. I'm a believer. I think you should be the next senator of Pennsylvania.
Thanks, Ed. I intend to be. Thank you.
All the best, my friend. We'll see you on the tube.